you? Good to see you. Good to see you, Eddie. Good afternoon. Thank you for joining me for today's update. I'm glad to have Dr. Jose Romero, Secretary of Health here, as well as our Secretary of Education, Johnny Key, and some of his team. I see Senator Bledsoe over there, Chairman of our Senate Health Committee, and other legislators that might be here as well. Let me first start off with some reporting news. Let's look at the graph for today, and there's some really good news in here. There's some not so good news as well, but first of all, the total cases last 24 hours, 2,343, which is up from a week ago. Active cases up, deaths very sadly as 16 additional Arkansans have died because of COVID. And then if you look at the hospitalizations that we always are concerned about, there's 30 additional hospitalized, 10 additional on vents, and you can see the counties with the cases. The testing, of course, is consistently been increasing as the risk increase. I did want to draw your attention to the doses given. Yesterday we recorded 30,000 doses given out. So you can see where the vaccine has increased in terms of its administration, in terms of the demand by the public. Colonel Ader, who is here managing the program, informed me that we're going to have to be ordering some new vaccines. And so the demand has increased. I'm pleased with that. And to put that in perspective, if you go to the next slide, you'll see how 30,000 compares to the 4-week daily administered first and the boost shot as well, 30,000 in the last 24 hours, and they tell me there's 25,000 that were new doses, and I think there's some that were came in late, but extraordinary 24 hours and success in the vaccination. We now have 14 counties that have reached the 50% of their population being vaccinated, and this reflects vaccinations of being a 250% increase in our vaccinations across the state. So thank you, Arkansans, for doing more research, talking to your physicians, getting information, trusted sources, and making that decision that helps us all. And then let me go to the next one. This is one I wanted to emphasize as well because it is on vaccinations and the vaccination status of cases, hospitalization, deaths since January 1 of 2021. So this records all of those different categories of cases, hospitalization, deaths since January 1. And of that, the orange at the bottom are those that have been vaccinated. The other color, the lighter color, is those that have been unvaccinated. So the cases you can see, small percent vaccinated, 94 of those hospitalized, 94.5% of the hospitalization of those have been unvaccinated, the deaths 97%. And so that tells the story of the added protection that comes with the vaccine. And now let me come to some comments. In the last legislative session, the General Assembly changed the law, as you know, to accept an equal responsibility in managing the state's response to the current public health crisis. From experience, I know how difficult the decisions are and how quick they have to be made when the state faces an emergency. But the law has been changed, which limits my powers as governor and transfers a significant responsibility to the General Assembly. As a result of that new law, the General Assembly met today and affirmed my most recent renewal of the public health emergency. And I'm grateful for the quick action of the General Assembly, both Senator Hickey, the pro tem, as well as Speaker Shepard, that brought the legislature together, carried out that responsibility, and passed and approved that public health emergency. And so now we all have one voice that there is a current public health emergency in Arkansas. This is an example of how the relationship between the executive and legislative branches can work successfully without delaying any emergency actions. Tomorrow, the new partnership will be tested again. I have called the General Assembly into session beginning tomorrow at 10 a.m. There'll be 2 items on the proclamation on the call for the General Assembly. First, the state of Arkansas ended its participation in the federal program that provided an extra $300 per week for those eligible and available for work. And that was paying them $300 a week to stay out of the workforce. This made no sense, and we ended it. Since that time, 2 things have happened. The number of Arkansans registering for work increased by 28%. Employers are hiring and people are returning to work. Nearly 160,000 Arkansas jobs have been filled since the announcement, and these numbers come from Workforce Services as documented by the Foundation for Government Accountability. Second, a state court judge ruled that the state did not have the authority to opt out of the federal program. And so for that reason, even though that's on appeal to the Arkansas Supreme Court, I did add one additional item on the call, which will be to provide legislative clarification that the intent of the legislature gave authority to opt out of federal optional programs. So that's item 1 on the proclamation. The next item on the call is related to the current emergency. And I have a reminder I should reiterate, and that is there is no statewide mask mandate. I am not in favor of a statewide mask mandate. There are no government vaccine mandates as well. These are about the choices that people make. But we do have a vulnerable group that is not eligible for the vaccine. The call that I've signed today asks the General Assembly to amend the law to give local school districts the flexibility to add protection for children under 12. The reasons for this is they are required to go to school. Secondly, we understand the value of in-classroom instruction, and we want those children to be as safe as possible. Local school districts are all different across the state, and they have different opinions on this, and they reflect different wishes of parents and their constituents. The local school district should make the call, and they should have more options to make sure that their school is a safe environment during a very challenging time for education. And so my ask of the legislature is to deal with these 2 urgent items because we are in an emergency and because both items relate to that emergency. And so with that, I do hope that they'll be able to convene at my call, that they'll be able to do the business, they'll be able to go home, and that we'll be safer because of that action and the partnership. Now, I did want, before I bring up Dr. Romero, I believe we have one additional slide here that tells us the challenge that we face in terms of hospitalizations. And this compares January 11 is the darker color, and then August 3, which is today, is the lighter color. And so you first have the percent of hospitalizations that are positive for COVID. And so you can see now 20% of our hospitalizations are positive for COVID as compared to 17.4% in January 11, which was really the height of the pandemic at that time. And then if you look at the ICU admissions, you can see it is also higher percent of ICU admissions now compared to January 11. And then if you look at those that are ventilated, you can see that that is higher as well. And so even though our raw numbers are not as high as January 11, the percents are higher, and that is really the pressure point on the hospitals. We're working very hard to address that. Our hospital administrators are looking at this. We're working with them through the Department of Health, and we hope we can address that serious challenge that we have on available beds, and anybody who's dealing with the hospitals in recent days understand that completely. With that, Dr. Merrow, if you would come.
Thank you, Governor. So I'd like to share with you all some sobering numbers and facts from the state. As of August 1st of this year, nearly 19% of all active cases are in children under 18 years of age. Those children that cannot take a vaccine, that cannot have a vaccine at this point, those under 12, account for more than half of that percentage. Between April and July of this year, there's been a 517% increase in the number of cases under 18 years of age. There's nearly a 690% increase in cases in children 12 and under. There's been an increase of nearly 270% in hospitalization among individuals less than 18 years of age. ICU admissions have increased significantly between April and July of this year by 275%. 20% of those are under 12 years of age. Among children less than 18 years of age who are hospitalized in July, 58% were less than 12 years of age. I think these numbers exemplify and bring out a very sobering aspect of the pandemic in our state. We have a group of individuals that are extremely susceptible to infection because they do not have eligibility for a vaccine. At this time, we have administered administered vaccine to 32.2%, sorry, excuse me, let me say that again. 32.2% of our population between 12 and 18 years of age have received one dose, and 18.4% have received a complete immunizing series. I share this number with you so that we can increase our immunization numbers among those that can receive it, and that we can encourage the use of masking. As the governor said, we do not have a mandate, but I clearly recommend this for children going to school. And I'll stop here and turn it back over to the governor. Thank you.
Thank you, Dr. Romero. Secretary Johnny Key, if you would come make your comments about education.
Thank you, Governor. Last week, the department released our updated Ready for Learning guidelines for public schools to begin the 21-22 school year. We had a very successful school year, as I've mentioned before, for 2021 in the light of the challenge that we all faced. This year, because of the Delta variant and the impact that it has, that is definitely more weighted towards the younger population, we see a number of challenges. But the strategies that we employed last year, we believe will continue to be effective. We've been working through the summer with districts in the use of their federal funds on the improvement of air circulation in their buildings, purchasing of equipment, purchasing of new buses, either larger buses or buses with air conditioning, all the elements that have been recommended. So the preparation for this school year has been ongoing since well before the end of last school year. Last year, we began in January thinking about what digital learning looked like. So there was no one caught flat-footed when it comes to being prepared for this school year and shifting to digital learning in those situations where the numbers based on the COVID-19 cases would dictate a school moving that direction. The one tool that we have this year that we didn't have last year is the vaccine. And we certainly do encourage our districts to think about how they can increase those numbers within the ages 12 and up. That is something we stand ready to support them, and we know that Colonel Ader, Dr. Romero, and their teams are ready to work with us to make sure that those the students and the parents that want to have access to that have it readily available to them, and encourage that through clinics, through other outreach efforts that schools are going to be a very important part of delivering. Thank you, Governor.
Thank you, Johnny. With that, we'll take any questions.
At least in the Senate, leaders there have said that the votes are not there even for a simple majority for the change in the mask mandate ban. Two questions. How are you going to get over that? How do you expect to close that gap? And the second part of that is, are you open to some kind of plans? I know there's been talk about having it triggered by types of transmission in community. Are you looking at some kind of limits on how this would be rolled back?
The response as to how you can give flexibility and better protect the 12 and under is subject to discussion. It is the will of the legislature as to how they want to best address that. The call says this is what we want to address, is the public health of those that are 12 and under. I've presented a bill that's in draft form, but if there's better ideas or other ideas, that's the will of the legislature as long as within the parameters of that call. And I've spoken with Senator Hickey and the Speaker both, and it's clear to me that there's many that just don't want this in their lap. It's clear to me that some school superintendents don't want it either. But this is a call that has to be made, and that's the process that is set up. And so we may or may not get there, but I want to give the legislature a chance to help protect those 12 and under and give the school districts that flexibility. And that's the way I see it. And the only option I have to carry that out is to ask the legislature to come and to review that and to amend the law.
The votes, are you optimistic that anybody will actually file that bill?
We'll see, and it doesn't, again, I'm not wed to the bill that we have presented. It's up to the legislative action. They can meet and they can consider it and they can say we don't want to do anything and they can go home. Or they can take action, as I've requested them to do, or some modification of that.
Sorry, can you talk a little bit about why you decided to sign the bill that became Act 1002? Do you regret it now? Was it a bad decision? I mean, why did you think it was a good idea to sign it at the time?
Well, I signed it at the time because our cases were at a very low point. I knew that it would be overridden by the legislature if I didn't sign it, and I was not supportive of, I'd already eliminated our statewide mask mandate. And so, I signed it for those reasons, that our cases were at a low point. Everything has changed now. And yes, in hindsight, I wish that had not become law. But it is the law, and the only chance we have is either to amend it or for the courts to say that it has an unconstitutional foundation.
Well, a lawsuit has been filed challenging the state constitution. Do you support that lawsuit? I know your name is a defendant.
I have not read the lawsuit in its entirety. It was just filed, I think, late last night. I am supportive of a legislative remedy, and that's the best, because if it's up to the courts and the courts strike down that law as unconstitutional, then that could mean we could have counties and cities all doing their thing and different standards, and that would be confusing. It would be bad for business. It would be bad for the public understanding and our concentration on vaccination. So I don't like that direction, but so that's why it is much preferable for the legislature to remedy the issue. Yes, sir.
So the call is limited to only schools that have students who are younger than 12.
Correct.
So given the fact that only like 18% of 12 to 18-year-olds are vaccinated, why not give those other schools the possibility of having mask mandates?
Because there's a remedy for them. They need to get vaccinated. Parents can make the choice. The students can make the choice to get vaccinated. The 12 and under is the only category that has no choice. And so, you could make an argument that higher education should be included, and they should have that flexibility. Or county jails, because you've got that exemption for our Department of Corrections. But the answer, in every one of those environments, they have access to vaccines. They can make the decision to have a vaccine, and protect their health in that fashion. Or they can wear a mask as well. But they have the remedy for the vaccine. The only category that doesn't is a 12 and under, and that's why I limited it to that narrow response.
Do you think that there's a 2/3 vote to extend the special session, past this time? And do you have any concerns about future bills that could be filed if so, such as ones concerning critical race theory?
The Speaker and Pro Tem would really have to address that issue. Obviously, when I make the call for 2 issues, I hope that we're an emergency. We don't need to get sidetracked into other issues. Let's stick with the emergency.
Governor, you're head of the Governors Association. I'm wondering what efforts that you and the organization are looking at the border crisis that we have now, that we have infected people that are coming and shipped to all different states around the union that aren't being vaccinated or even being tested. And are we trying to bail out a boat that's sinking is what I'm wondering. In other words, we were doing good. Then suddenly we're wondering how come these numbers are starting to increase, and I'm wondering if do we know how many of those folks that have been shipped here to Arkansas, then how many of them might be infected?
Correct. Just go ahead and ask the
and if
question.
you're going to address that to the president as a group, as a governor's group.
First of all, that is absolutely a relevant question. It is a concern, particularly for those along the border areas, but as you indicate, they will wind up coming here and they will be able to access our healthcare system. And if they have the virus, it can spread from that. So those are relevant questions, and that's one of the reasons other reasons, but support the control of the border and stronger action there. We must secure our border. But regardless of that issue, we have a predominant strain in Arkansas, the Delta variant, and we're going to have to address it regardless. That is something that I will look at individually as to whether my voice can count more there, and perhaps through the NGA as well. Yes.
Questions for you. Is there any guidance for preschools, daycares, since they're clearly younger than 12? And my other question is, the eviction moratorium just expired. Given the Delta variant surge we are seeing here in the area, is there any sort of guidance or anything you think that the legislature should try to address as far as evictions go, since we're seeing such a surge in cases right now?
The last part of it is on evictions?
Yes.
Okay. On the first part of the question, if it's a public school environment for preschool, then this would still apply to them because they're under 12 and not eligible. So the public school environment can be directed by the flexibility given to the local school board. If it's a private environment, they can make their own rules and requirements for their private sector business. So I think that would be addressed. If there's any other rules on that, you can comment on that. In terms of the eviction, this is a concern simply because we're working, money is adequate. So the funding for those that need rent assistance is there. We're doing everything we can to market it. We're coordinating with landlords because we want that money available to where there's a need. And it's been lightly utilized in Arkansas, and I shouldn't say that. It's millions and millions of dollars have gone out to rental assistance. But we want to make sure that if there's anybody, whether landlord or tenant, that is behind on their rent, go to our Department of Health website and access that rental assistance. We ought to be able to get that to you.
I guess just to clarify on the PUA part of the call, is that just trying to clarify who has the authority to opt out of that, in essence? Or what are we trying to address in that, just to clarify?
It's basically an affirmation of the decision that was made, first of all, and then secondly, clarifying it's the intent of the legislature that the Director of Workforce Services has the discretion to opt out of those voluntary or over-the-top federal programs.
Let's say Act 1002 is not amended in the end. What is your fear, what is your concern moving forward, especially with these statistics that Dr. Romero just said about these insane increases in cases, especially in kids under 12?
Well, the concern is there, and that's the reason for this action, and that's the reason that the legislature should act as well. Now, if it's not changed, what do you do about it? Well, we're going to continue to make sure that we have as safe an environment as we can in the schools. The local school districts will not be able to impose any requirements, but we still have the guidelines in place, just as Dr. Merrill recited, you know, that individuals make the decision, parents make the decision, encourage mask wearing to comply with the guidelines of the CDC. But as you can see from the statistics that came from the Marion School District that started earlier than many of the rest, those numbers are not good. Those numbers are not good, one, because of the number of cases, but two, because of the number of quarantines, which means there's not a very high percent vaccinated. So what we're going to do, and that's the most critical thing, is to develop a cocoon, to develop more people in the school environment vaccinated, and that gives you better protection in schools. Vaccinations is the best answer. The rest is just simply trying to take care of those people that can't be vaccinated.
Does it give you hope that that could happen, especially with, we just had more than 30,000 Arkansans get vaccinated in 24 hours?
Oh, absolutely. I think we've seen a sea change in attitude, a sea change in action, more importantly, of people stepping up to the plate, recognizing it's important for their health. And I think you're seeing also more people trying to get accurate information, of going to the doctors, going to whoever their healthcare professional or trusted advisor is, and really searching for true information, because there's too much at risk not to do that.
Governor, wanted to clarify something you had talked about last week, or you had said last week. You don't see emergency powers as an option if you're not able to do this legislatively. Is there a legal reason, or is that political reason that you would not seek it through emergency powers, the mask, changing the mask law?
Well, I think your question goes to, is the restrictions on the governor's powers during an emergency constitutional or not? And, you know, I have my views on that. I have some questions constitutionally about that. Ultimately, the courts would decide that issue. But it's important for me that I work with the legislature. I signed some of these bills into law, and we work through this. I respect the legislative branch, and if we can work in partnership to address this pandemic, then that's what we want to do. But I have to lead as governor, and I will lead through the tools that I have. And I've got significant tools, but I need the legislature to back me up on it.
The Department of Workforce Management, you said that you may go back to the additional, if they decide to go back, they opt into it and they decide to go back to the additional unemployment. You say they may do that. But are we ready for that? Have we corrected all the problems, delays and things in getting that money to those people?
I think the system is working now. Every change you make in the system takes a little bit more software development or changes, but the system is working, so I think that they are prepared in the event that we have to do it. But it's still, I mean, if we had to go back, it would take some time. I want to be careful about the length of time, some time to change the system to readjust that. Let me go. Do we have anybody on the phone or remotely?
Hey, Governor, this is Andrew Epperson from KNWA News. I have a question about contact tracing. Is that something that we're still doing? And if so, are the contact tracers able to keep up with this rise in the Delta variant?
The answer is yes and yes. We are doing the contact tracing, and on the latter part, I probably should be a little bit more careful in my answer that I asked a number of days ago about that, and they were keeping up. Of course, we had to rebuild their workforce because they had let a lot of them go, and so they're bringing those back to do the contact tracing. But it is working. Obviously, as the cases go up, there is some delay in getting the work done, but they're hard at it. And Dr. Merrill, do you have anything else on that?
That's exactly right.
All right. Next question.
Hey, Governor. Elsie Helm. NWA in Fayetteville. I have two questions for you, if you don't mind. The first, as we're seeing hospitalizations continue to rise across Arkansas, here in Northwest Arkansas specifically, we're seeing our ICUs filling up. In fact, we had a sister wait 14 hours for her critically ill brother to end up getting a hospital bed. So I'm wondering if there's at any point when we'll see elective surgeries put on pause like we did at another point in the pandemic. And then my next question has to do with the chart that you showed that compares vaccinated people to non-vaccinated people in terms of the deaths, cases, and hospitalizations. So this chart says it's since January 1st. How accurate of a depiction is this when, I mean, quite frankly, vaccines were not widely available at all come January 1st, let alone for a couple of months after that. So it's, I guess it's kind of shocking to see how many more people were vaccinated when you look at that chart.
Okay, in terms of the elective surgery, that's the last thing we want to do is to restrict those health needs that are urgent, that people need to have taken care of that's been delayed. So we don't want to do that. Obviously, there's delays right now. As you can see from getting access to an emergency room bed or an ICU bed, that's a challenge for us. We are working with the hospitals for a joint approach as we did during the height of the winter, and we'll have more to report on that in coming days. In terms of your second question, Dr. Romero, do you want to address that?
Thank you very much for that question. So we are gathering data on that, and we'll have better data in the next few weeks. There is not enough data under the current Delta virus to tell you. But what we can say is confidently is that receiving the vaccine decreases your risk of being hospitalization and decreases your chance of dying. So we'll have more concrete, narrowed data in the next few weeks. Thank you.
Any other questions?
Governor, Mike McNeil, MagnoliaReporter.com. Tyson Foods said today that it's going to require all employees to be fully vaccinated by November 1st. Will you encourage other employers in Arkansas to implement a similar decision, except perhaps with a timeline of hours and days instead of weeks and months?
What was the last part? Instead of hours a day? I didn't follow that.
Will you encourage other employers in Arkansas to implement a similar decision, except perhaps with a timeline of hours and days instead of weeks and months?
Well, that's an individual business decision. I am not encouraging businesses to do that, but I certainly respect their concern of their employees, their public health environment in their workplace. They have a lot at stake, and so I support the decision of individual businesses to make their decisions on those health issues. And as to others, I think every business is going to make their own decision. Obviously, a lot depends upon the sensitive environment, and of course in Tyson's you certainly recognize that they had such an outbreak in poultry processing plants early on, but it was an essential industry. They continued to work, so there's a lot at risk there. And they're doing everything they can to make sure it's safe. The second part of it is I just want to recognize how much the employers are doing to increase vaccinations, even voluntarily, through incentives, through paid time off. I think they're really stepping up the plate for us. Next question, right here at the table.
You just wrapped up traveling around the state with your community COVID conversations. What was the biggest takeaway you had from those, and how do you move forward?
Well, first of all, we might not be done yet. In fact, I intend to go out next week. We took a pause this week because of the session, but I see that this will continue until the start of school, at least. And so that's important. It's working, and I want to go to other communities. What's the biggest takeaway? People are searching for information. They get a lot of misinformation out there, and that the biggest takeaway is that it's not what the government tells you, but it's what people you trust you get your information from, and that's what they rely on, and that's what helps them to make the right decision. And so that's the the beauty of the conversation is that someone raises a question, and then someone in the community who has knowledge of this answers that. It's a trusted person, and it's that conversation that makes it beneficial.
Seems like we've had some etch-a-sketch type things that have happened. I know that, was the doctor that talked yesterday at the committee, that testified. She, I think either Kim Hammer or Senator Kim Hammer or Senator Sullivan he'd actually got a message showing that the CDC basically said that masks didn't work, and then turned right around and asked the expert witnesses, and she said she disagreed with the CDC. That's kind of leaving us some inconsistencies, and you talked about just now, is trust. We need consistency in the thing if you're going to get people's trust.
Consistency, reliability, building trust, confidence, and transparency. And, you know, CDC gets a lot of criticism, but they were very transparent in their own information about the breakthrough cases in Providence, Massachusetts. They didn't hide the fact that there were a number of those. I think there were 1,000 cases, and there was a certain number of those that had the vaccination. And so they were transparent. They put that information out to the public. They don't hide that. And to me, that builds confidence. I talked to the governor of Massachusetts on that, and he said if they hadn't had vaccinations, those numbers would have been much higher, and the hospitalizations would have been much higher. So with that, thank you all for your attention to this today, and I look forward to seeing you again. Thank you.